Welcome to our Information Skills video tutorial on using PICO to formulate an answerable clinical question. By the end of this video, you will be able to understand the PICO acronym and how to use PICO to formulate an answerable question, and construct a PICO from a clinical scenario, dividing your question into distinct components or concepts. This video is 9 minutes long, and there's a short quiz at the end with sample clinical scenarios to test your knowledge. First of all, it's important to remember that searching databases such as Embase or Medline isn't the same as searching Google. Don't try to search for everything at once, typing all of your keywords into the search box.
Instead, divide your question into separate components or concepts, and search for each concept individually. And when we get to search the database, we'll show you how to combine your separate concepts to retrieve more targeted search results.
Especially for clinical questions that involve an intervention or treatment, PICO is a really useful acronym that can help us formulate a well-structured and answerable question.
PICO subdivides the question into 4 important components or concepts. P, the patient, population, or problem. Who is the person, or what is the group of people, the population, that you have in mind? Or, what is the disease, condition, or clinical problem that you're concerned with? I, the intervention. What is the main intervention or treatment strategy you want to investigate? Which might be a medical treatment such as drug therapy, or a surgical procedure, or an exposure to an environmental hazard. C, the comparator, or control intervention, if you're comparing one against the other. And O, the outcome or outcomes. What are you or the patient most concerned about happening or preventing happening?
P, the patient, population, or problem. I, the intervention. C, the comparator or control. And O, the outcome. Intervention questions are the most frequently occurring type of clinical question, so as we'll see, it's possible to apply PICO in a wide range of clinical scenarios.
Consider this example. The parents of a severely autistic 6-year-old boy are unhappy that no interventions have significantly improved his lack of social communication. They were excited to learn from the parents of another autistic child that a new treatment, the use of intravenous secretin, has resulted in a dramatic benefit for many children. Could this treatment help their child? What's the PICO of this question? Well, in this case, we might say that the P, the patient or population, is a 6-year-old child with severe autism. The I, or intervention, is intravenous secretin, and that the O, the outcome, is improved social communication.
Notice that we don't have to use all of the elements of the acronym to construct our PICO. Here there is no C, or comparator treatment.
Based on our PICO, we might construct a clinical question as follows. In children with severe autism, does secretin, compared with no intervention or usual care, improve social communication?
Let's take a look at another example. A 2-year-old child was playing with his brother at home, fell, and cut his head. His mother brings him into the local emergency department, where a resident examines him. He has a 2-centimeter horizontal laceration on his forehead. The cut is deep, but not bleeding. His mother is concerned about the discomfort associated with closing the laceration, healing time, and also cosmetic outcome. The resident wonders if Dermabond skin adhesive might be better than sutures in this situation. Here we might say that the patient is a 2-year-old child with a laceration to the forehead. The main intervention we want to investigate is Dermabond skin adhesive. The comparator intervention, sutures, and that the outcomes of interest are potential pain or discomfort, healing time, and cosmetic outcome.
And for our clinical question, for pediatric patients with a simple facial laceration, Does Dermabond topical skin adhesive, compared to sutures, result in better cosmetic outcome, faster healing time, and reduced pain?
Let's finish with a quiz to test your knowledge. After each of the next 3 clinical scenarios, pause the video when prompted and write down what you think the PICO should be. A hearing test is an important component of the physical examination of older patients. Some clinicians simply ask patients about their hearing ability, and others use a tuning fork to test it. But Dr. Khan is fairly certain that a simple whispered voice test is very accurate. Challenged by colleagues to back up his assertion with evidence, he has come to you to help carry out a literature search. What PICO should you use? A 27-year-old woman just diagnosed with hepatitis B has been taking acetaminophen for headaches. Her mother has heard that acetaminophen can cause liver problems, and she asks you if her daughter should continue taking the drug for her headaches, considering her Hep B diagnosis.
An administrator from a local nursing home is considering banning the use of atypical antipsychotics. She's heard that they are associated with a significant rate of cerebrovascular accidents and may be no more effective than behavioral interventions. Is this true?
On the example of the whispered voice test, P, the patient or population, is an older person, generally referring to individuals 65 years or older, and the problem is hearing impairment. I, the intervention, is the whispered voice test. C, the comparators are the tuning fork test and the patient's own testimonials. How do they define their own hearing ability? And O, the outcome is to identify hearing impairment or hearing loss.
On the acetaminophen example, P, the patient is a 27-year-old woman with hepatitis B, and the problem is headache. I, the intervention, is acetaminophen. And O, the outcome in this case is a negative outcome, liver damage.
Lastly, on the example of atypical antipsychotics, P, the population of interest are older people, nursing home residents, in this case with agitation or mood disorders, which require an intervention, I, of atypical antipsychotics. And O, the outcome is, once again, a negative outcome, CVA or stroke. Well done, you've reached the end of this tutorial. You should now feel more confident in being able to use PICO to formulate an answerable clinical question and construct a PICO from a clinical scenario, dividing your question into well-defined components or concepts.